Thank you. So let's start and let's wake up with some information. We start from the origin, from the sodomism, that means an act of anal sex or sex between human and animal. And this comes from Sodom, that was an ancient town destroyed that the archaeologists found in Jordan. And it is reported in the book of Genesis that the people of Sodom were wicked and were sinning greatly against the Lord. And the Lord rained down burning sulfur on Sodom, destroying all those living in the cities. Even if the relationship between sodomism and anal intercourse comes from this book, is not the destroy is related to the umbrage against the guest and not directly to the anal intercourses. It comes from an interpretation of this event. Anyway, if we check the timeline, we see that in the ancient Rome, sodomizing a slave was sign of his master's power. And from the 13th century until the 18th century, sodomism was punished by the law with death at the stake. And the first certificate was in 1277. In fact, this practice was considered dirty and impure because of stool residue which may remain on the male genitals. But there are 4 different types of anal intercourses: male to female, male to male, female to female, and also female to male. There are also some related erotic practice like fingering, enemas, butt plug, fisting, figging, that it is based on the peeled root of ginger that burns, and is something that may give pleasure. Pegging, that is related to an intercourse between female to male, and also anal gaping. But anyway, I will let you to check online at the end of the presentation. Anal intercourse is always the hidden side. In fact, it is considered a taboo. Taboo is a Polynesian term that signifies that the thing is forbidden, and so attract the people. But it has its own relevance. In fact, from this study from Indiana University, they declared that 94% of females reach the orgasm through the anal intercourse. Here I reported the statistics about anal intercourse among heterosexual. And this epidemiologic data deeply underestimate the actual numbers, that is around 20% of heterosexual. Here instead I reported the percentage of homo-bisexual of the total population, and you see that the average number is around 5.5%. But the real impact has given that from this important community, that is the LGBTQ community. That means lesbian, gay, bisexual, transgender, and queer. In fact, among this community, up to 95% of this high-risk population experience anal intercourses. And also 2.2% of men and 1.3% of women sexually active declared involvement in bondage, sadomasochism, and dominance and submission in the previous year. So relevance number. But what does it happen after surgery? We have to face with different diseases and different surgical approaches. And the problem has its own entity. In fact, if we check on Google anal sex, anal surgery, we can find a lot of websites or blog facing this problem. And also in the J-Pouch community group is faced this problem. So, which are the questions? Who really asks the sexual habits to the patient? Who explained to the patient, among the possible complications after surgery, also the possibility to change their own sexual habits? And who chooses the most appropriate procedure to treat the disease and reduce the impact on sexual life too? And also, may the staple procedure really increase the risk of anal pain or penile trauma during anal intercourses? Do the staples remain in the rectum forever, or they will be shed? I put this last question because I found an article published on colorectal disease in which 16 surgeons were asked to answer if the staples will be shed or will remain after surgery, and 10 of them answered that the staple will be shed completely. In literature, we have different journals about sexual medicine, but no one deepened this topic. In fact, we have no original papers, only a few case reports with tips and advice. Here I report some case reports. So we need more. When it is safe to have anal intercourse after surgery? Who knows the answer? You should be able to return to sexual activities in how many days? Who knows really this answer? So from this background arrives our study that is already published as an abstract in Techniques in Coloproctology and Colorectal Disease. In fact, from March 2016 to February 2018, an anonymous questionnaire was submitted to all the patients over 18 years old who had undergone proctological surgery in 2 surgical units of a tertiary referral center. And the only exclusion criteria were incomplete healing after surgery and less than 3 months of follow-up. We collected a total of 929 patients with a mean age of 46 years old with a range 19 to 75, and the mean interval since surgery was 10 months with a range for 4 to 20 months. The overall preoperative anal intercourse rate was 22.5. The anal receptive intercourse among men was 16.7, while among women was 28.9, so almost 30% of our population. But if we exclude HPV positive population, the overall anal intercourse decreased to 16.5, the male anal intercourse to 5.5%, and the female anal intercourse 25.3%. So here I reported our results in this table, and you see that highlighted we have the p-value significative with the difference from preoperative anal intercourses and postoperative among fistula in ano treated with sphincter saving procedure. All the procedure for treatment of hemorrhoidal prolapse, fissurectomy plus sphincterotomy, the treatment of obstructed defecation with STAR, and of course also the procedure related to anal warts HPV. Here I reported the abandon rate for each disease and each surgical treatment, and the overall abandon rate is 47.4%, so pretty high. And you see that the highest value we have in the group of fistula in ano, maybe because of the long history of this patient. The experiences reported by our patient during intercourse after surgery were pain, stiffness, and partner discomfort without any event of condom rupture or genital lesions. And the main causes of abandon rate were 43% fear of pain without any real attempt, because maybe they didn't know when to try again, and they are scared about. 35% experienced pain, really. 22 haven't answered. So, in conclusion, it is fundamental and adequate preoperative counseling with the patient to investigate also the sexual habits of the patients, report the possible influence inside the informed consent, and help the patients to overcome the fear of the pain after surgery. Moreover, it is still undemonstrated what may be the consequence of a forced sexual intercourse interruption, and how much a frustrating sexual life can influence mental and emotional well-being and health still remain an open question. Thank you.